and thank you for having me. I'm a practice in Thailand, okay, in Bangkok and in my hometown. For now, we have the second wave, the pandemic in Thailand. So I think that's affect a lot of our treatment, especially for reproductive medicine, because the operation room mostly stop for the elective operation. For example, for endometriosis, for tuboplasty, right? For the even for the uterine fibroid, because the government think this is elective. We can postpone the case because now we choose to save the equipment and the resource for the COVID era. So that affect a lot, especially for the IVF patient. I think same as in the USA, same as in the Europe. Mostly they would like to postpone the case, but who know when, right? When the pandemic is stopped. So it's a little bit difficult for us to work. The burnout, actually, in my opinion and in my experience, I think for now I don't have to burn out in the COVID era. But I would like to find out the solution, how to take care of the patient or how to treat the patient most proper in the optimal way between the list of infection and between the list of their disease. I think it's very challenging. It's very fun. In Thailand, we will have the COVID vaccine in the mid 2021, but in my opinion, I have some question. How about the coverage of the vaccine? This is very important because in Thailand we are not a developed country. We are a developing country. So I have no idea how much vaccine we will get. So I think the coverage is very important, because if we can give the vaccine for only some group of the patient or even some group of the healthcare provider, the effective of the vaccine is not the best. So I think we have to wait for the coverage of the vaccine. If we can coverage 60%, 80%, I think everything is back to normal. I think everything will change because, of course, when now we are in the pandemic era, right? And after this, we in the vaccine era. But after that, we will make sure how about the effective of the vaccine, right? This is the era. And I think between this, we will change all of our, how I say, the patient journey, the doctor journey, the treatment journey. For example, for now, we use the Zoom to talk together. I think if 2 years ago, I will be face-to-face in front of you in somewhere in the world. But now we use the tele. Same for the patient, we use a lot of telemedicine. We send the data to the patient house. We have some intervention directly to their house. I think so. Everything is changed. Yes, I think of course for sure this is the new thing for the meeting, but I think it will be more balanced. For example, I think we call the hybrid meeting, because sometimes for the medical meeting, if only online, we was distract for something else. For example, if during our meeting, maybe my daughter come here to distract me, right? So I think hybrid is the best way, because for the people, we need connection face to face, because we can know like a body language. We need to know the atmosphere of the room. Mid of this year, my case was postponed a lot. I think like 4 or 5 months without any elective surgery. So and then it's back to normal. But I think in a few months, the next few months will postpone again because we have a the second wave. And for OPD visit, I think there is something changed. We have to wear the mask. We have to wear the how you say, this is a surgical mask and this is like a shield, face shield. Yeah. And in some places we have like we have to sit in the box. So I think the experience is changed. I would like to talk to the patient face to face without the mask. Because we have to like read their like expression, right? If we have the mask, we cannot know about their expression. So it's a big difference. It's a big difference. Of course, I think the patient is more comfortable with the platform, the digital platform. In the past, before the COVID era, most of the patients, they don't use a lot of their phone to learn about the healthcare. But now everything is changed. Their behavior is changed. They order the food for the delivery. They shopping online. They use the Zoom meeting. And now the time for healthcare, because they have no choice. Most of the hospital they change the protocol. They visit the patient to use the telemedicine. And some, for now in my hospital, they stop for the friend of the patient to visit them. We can use only the tele for visit the patient. So it's like a new rule already. Everybody have to learn how to use it. It's very useful, right? Because social distancing is very important to stop the pandemic. So if we have the new strategy to stop the expansion of the disease, so it's very useful. And now if we use this, is more like we used to it. It's more comfortable for the doctor to take care of the patient from anywhere. For example, some patient who in the rural area, they can access to see the doctor in the city. It's easier for access to the doctor, right? So, but in the past, they cannot use it because, like for example, there's the regulation. The government they not allow the doctor to use the tele. But for now, the Thai government is open to apply the telemedicine to take care of the patient. So it's very useful. And for the lesson learned, I think we have to learn, lifelong learner. We have to be the lifelong learner because everything is changed. For example, in the past, I'm the surgeon. In the past, we used to the open surgery, right? And now the time to the laparoscopic surgery, right? We have to continue us learning. This is the same thing. The pandemic is coming. We have to learn how to work in the pandemic era, how to take care of the patient in endemic era. And we have to learn. For example, I think in March, we have very few information about the pregnancy and COVID-19. And now we have more data about the pregnancy and COVID-19. So we have to keep learning everything and apply to our practice. So I think only one lesson learned is keep learning. So I think we have to live in the pandemic era at least 1 year, 2 years, and who knows, maybe 5 years, because maybe there's COVID-21, COVID-23, right? Who knows? Just keep continue us learning, and God bless you. Thank you. สวัสดีครับ Namaste.